that one. The funny thing is I've never met Ryan before, and he actually stole a lot of what I was going to tell you guys. Most importantly, to show up, but I'll get to that in a second. Good sort of morning. When I wrote this presentation, I thought it would be morning. Those of you who know me, and now soon those of you who don't know me, you know that I love bacon and I love coffee, and I've had both this morning, so things are great. So this is my name. It's kind of unpronounceable, but it's Gitte, so there you go. I have my email address up there. Feel free to email me questions, your blood work, if you want to come observe me in Amsterdam, that kind of stuff, if you're passing through. I'm going to see if I can I actually scroll on this thing? Not like that. How can I scroll on my notes? Yeah, but I want to scroll on my actual notes. There we go. Cool beans. You might wonder what I'm talking to you about this morning. I'm not sure myself, so I just came up with something. I shared my chiropractic manifesto with Derek at one point during a Facebook chat. You gotta love Facebook for that, eh? And I guess it inspired him or provoked him enough for me to come talk to you this morning. Again, not so much morning as I anticipated. And unlike Ryan here, I'm not a professional speaker, so I'm just kind of blurting it out there and hopefully not going too fast for you guys. I'm having a bit of a deja vu here because I was at WCCS in 2003, and there was a couple of old WCCSs there, and they're all bald and graying, and they hadn't really taken the WCCS experience much further. And I'm here to tell you that you can and you should. Actually, I think I chaired the WCCS in 2005 in Denmark, and that was the reason I'm now the ECU convention organizer, because the then Norwegian president, he saw me and he saw the potential for leadership, and that's why I have the position today that I do. So who knows where Derek will take this, hey? Any kind of international association would love to have you. A little bit about me. So I graduated back in 2004. I was a student faculty advisor, so the link between the faculty and the teachers and the students and the external world. I was the student rep on the course committee, on the executive financial committee. I discovered the WCCS on a student trip that I organized to the ACC. We took 28 students to ACC and just kind of saw what that was all about, followed them around. So I founded the WCCS chapter and went to Palmer Lyceum in 2002, quite the eye-opening experience, where we didn't get voted in. Denmark didn't get voted in because we had a lack of philosophy classes. So I don't know what stories you've been told, but that was the actual fact. So the next year in Quebec in 2003, what a beautiful Congress you had. Thanks for that. I had all the floor time I needed before Congress to explain how things worked in Denmark, and we got voted in. And let's see if I can figure this one out. So my track record is Palmer 2002, UQTR 2003, Sherman as a vice president 2004, the chair in 2005, and UJ in 2007. Oh yeah, I also organized a student trip to the CMCC in 2003 because you got to do something with your spare time, right? So I moved to Holland straight after graduation. So I learned Dutch in about, I'm going to say 6 weeks or so. That should do it. And in my internship year, I spent some time on the PR committee, and then I went on to be a member of the executive board for 3 years. Then I was the local organizing committee leader for the ECU convention in 2012 in Amsterdam. And I'm back on the board of the NCA, the Netherlands Chiropractic Association. And since then, I've been involved in all kinds of work and organizations and different levels and different roles. I can tell you it's complex, it's diverse, and very little is as it seems. So just, if I don't have any answers for you, I may have questions, and you should keep asking questions too. And I'm thinking I'm preaching to the choir here, because you're already here, you're already showing up. Thanks, Ryan, for ruining my moment. Because you're already here, you already paid at least part of it out of pocket, and I implore you to keep doing that and keep staying curious and show up. But you're already here, so we can skip that point. Thanks again. Do feel free to corner me, like my new friend from Life Wested. Where did you go? Anyway, she cornered me just before, and feel free to do that whenever. I'm here all day. And stay curious, because I think that's the most important quality in any human being. How do I now slide this on? Hello? There you go. I wanted to put up some videos to some of my patients so that you can experience through them what it's like to be my patient, but time happened and went. So I only actually have one patient who's also one of my greatest referral people to my practice. She'll be there in a second. I'll cover a little bit of the art, science, and philosophy as I see it. I'll talk a little bit about the civilization, about the causes and the consequences, and beyond. And finish off with some words of wisdom for you and some books that I really enjoy reading that I'll recommend to you. Let's see how do I play this video, guys? Double click on it, maybe? Well, it played beautifully on my PowerPoint presentation, but I don't get sound. You can't hear this. But she's beautiful, right? She's Spanish. You can't hear it. You can't hear this.
Our clients as a form of support to Gitte, who is a chiropractor. Whenever we feel that our clients need special attention,
This is
to correct the spine and to make physical.
But great posture, right?
But also when we suspect any hormonal problems such as thyroid problems or a problem with lack of vitamins in balance and even some vascular issues, low blood pressure.
Yeah, this is,
hypertension.
I think, points for effort.
So
If you want to move the laptop over here, we can hook it up for sound.
She's just really appreciating that I am a holistic practitioner, and she wishes you a great conference, and she's lovely. I treat her entire family.
Takes the blood pressure on the left, on the right. She checks the vitamin intakes. She
I order blood tests whenever I can. You know, let's just you can always watch this in a break, because it's just gonna take a little too long. Right. Are we onto the screen now? Actually, maybe we can close that curtain, because I think that'll be easier for you to check out. I think the classic triangle of the art, science, and philosophy of chiropractic is very, very relevant today. You still have to be a really good adjuster. This is our core modality. This is what you're going to make your living off. Whatever else you do in terms of soft tissue or low impact or whatever, a good adjustment is your core business. And keep practicing. Even though you don't feel confident to act as if. It feels like you're faking in the beginning, but sure, you'll be convinced. And I think if you can know one technique really, really well, so that's your fallback technique, but know others so that you can suit your technique to the patient's needs and not vice versa. After all, it's about them and not so much about you. I think it's actually been researched. I don't have your references for that, but no technique is superior to another on a general level, but to that one patient, it might make all the difference if you use blocks instead of diversified, or instead of activator, you use Gonstead. So, and this is the problem I have with those huge RCTs, randomized controlled trials. It's too big and patients are too complex. Will adjusting the L5 in low back pain get results in less pain every time in every single person? Probably not. If people are smokers, they heal slower. If they are, totally pro-inflammatory diet, they're under a lot of emotional stress, they will heal in a different way. And what if their neck is totally subluxated, but they don't have any pain there? And I will tell you how I deal with that. I'll have people lying on their backs supine. I'll apply a little bit of traction to their neck, and I'll ask them, so how do you feel that in your lower back? Like, is that annoying? And quite often they'll say, yeah, I feel that. Then I'll adjust their neck, and I'll traction again. Do you feel the lower back now? And they're like, no, how'd you do that? Well, I used an asymptomatic subluxation to give input to the cerebellum, to the red nucleus, to the thalamus, to gate, to dampen the input to the sensory cortex so that they experience less pain, which is pretty cool. It's not every time, but it's pretty much instant, and it's 9 out of 10 times. In my experience, I haven't made research project out of that. So that could be why when we see these big trials on do we adjust the low back for low back pain, how often does that work? It's kind of like averaging out, but if you could incorporate, I would love to see a study done on that. If you could just incorporate asymptomatic subluxations and see what then happens to people's pain levels or health levels, that would be great. So whatever research aspirations we have here, please take that away. Science is really cool. All of it. To me, there is no such thing as a chiropractic science. Once science is, I like the F word and used properly. Irritable bowel syndrome. Whenever science is published, I don't really care if it's a physiotherapist that published it. If it's awesome, I'll use it. And if it's a chiropractor who published it, but it's crap science, I don't want to use it. So, as long as it's out there and it makes sense to me, I'll go ahead and use that. And apart from the Internet Movie Database, I love PubMed because there's like the weirdest shit on there. Say, for instance, you Google or you PubMed blood-brain barrier dysfunction. Like, that's the one thing I thought really had my back or my brain, to be specific. But try PubMeding blood-brain barrier dysfunction, and you'll be amazed how much that can actually break down and how much we can help with that with some functional medicine interventions. Try Googling or PubMeding gluten ataxia. You'll wonder why you've never heard about that before, but gluten can sometimes or quite often be a neurological condition. So you might want to consider that with your patients that are just not responding or doing weird stuff with their brains and their bodies. There could be a gluten problem. How about searching sleep deprivation, you guys? And interleukin-6, maybe throw in a hippocampus, and you'll see that you're smarter to go to bed on time, like I did last night, because you'll retain more information in your hippocampus. So whenever you're studying for exams, go to bed on time, because studying until 2 in the morning and then get up at 6 to study some more, it's not going to make you retain that information. So if you know that now, you're going to preserve your hippocampus for a lot longer, which is where, science is really cool. And then we get on to philosophy. To me, kind of like Ryan said, we're almost twins. To me, it's a way of life. I'm a primary healthcare provider. Most of my patients will go to see me and ask me questions before they'll ask their GP. I will absolutely tell my patients that I don't heal them, that I facilitate their healing process, but they do the actual healing. I may be able to facilitate that on the table physically. I may give them gaze stabilization exercises. I may give them cerebellar stimulation exercises. I may give them information and tools so they can take better care of themselves. Because ultimately, I don't want them to make them dependent on me, but be smart enough on their own. Know as much as you can about your patient. That kind of makes sense. But if you take a full history, not only will you get smarter about their current health situation, but they will too. They will start making the dots connect and see patterns where they didn't before. And whenever they experience a change in their health, not related to pain, but change in health, they will associate that with the care that you've given them. And this is a beautiful example. This woman from Senegal who came in, low back pain for years, and through my questioning her, she went to the bathroom twice a week, and it took her 45 minutes to poop. And so I just her on a Friday, and I'll say, I'll see you next Friday. And she comes in on the Monday. I'm like, did I screw up the schedule? No, I want to make an appointment for my daughter, and I've pooped all weekend. I'm like, great, thanks for sharing, sweetheart. And I'm sorry about incurring cost in, toilet paper, because this is going to get expensive, right? But she has pooped all right ever since, which is, that's not in the randomized controlled trials, right? And she's, the longer your poop stays in your body, it's going to get reabsorbed. It's going to annoy the mucosal lining of your colon. You're going to get colon cancer, all the rest of it. So, all I know is I could have, helped her not get cancer later on just by adjusting her spine. What else I got? Consequences of a subluxation is, you could call it a subluxation, you could call it a locked joint or a functional lesion. I think we can agree that it has far-reaching consequences, not just on that segmental level, the muscle tone, but also the suprasegmental level on the brain level, right? There's been great research coming out of the CMCC, actually, from Brian Budgell, that there is somatovisceral connections and somatoautonomic connections on a lateral, segmentally organized level. So usually we can say that cells that wire together fire together. So even after if you remember back in your embryology class, right? You're like a pancake, and those segments are whenever they start migrating, those cells that wire together, they will fire together. This is probably why I adjust her lower back, and that sclerotome concurs with that level of nervous information going to her colon, which is, helping her greatly. So it's not pressure on a nerve, it's not bone out of place, but it's probably a situation of cells that wire together, fire together, and proper afferentation. Can I say that I treat constipation? No. I will treat people and see what happens. The body's amazing for self-healing. I think that Didi had a point. In his 1910 text, he identified 3 causes of subluxation: thoughts, trauma, and toxins. And the rigorous among you will know that he said autosuggestion, but I think that's just a very old term, so I've replaced that with thoughts, because that's easy to remember. Thoughts, trauma, and toxins. So talk about the 3 causes of subluxation: negative self-talk, emotional stress, grieving, that kind of stuff could influence that. If you're talking about trauma, sitting all day like you're doing today, good luck with that. Lack of activation, or macro trauma, so banging your head, sports, contact sports, big in the NFL at the moment, everybody's got a concussion there. Car accidents, that kind of stuff. Or toxins in the way of too much or too little of a compound that your brain needs to control your body or your muscles, and your organs, by the way. Something as simple as hypotension, so too low blood pressure that most of you girls have. All have low blood pressure. You feel a little faint when you stand up quickly, right? Orthostatic hypotension. Asthma, smoking will interfere with the delivery of oxygen to your brain. Diabetes or hypoglycemia, so going long without food, will change the glucose delivery to your neurons. Vitamin deficiencies, don't get me started, but that's huge. So what am I saying? That if we don't address these causes of the subluxation, but we only adjust our patients, what are we actually doing long term? Doom to doom. I'm more than halfway through. So I think we can say that something happened. So somebody gets the subluxation, and that has consequences. But also, I think most chiropractors, they will go ahead and adjust a subluxation, right? That would make sense to most, I think. I will share with you 2 examples of that it also has consequences. This young whiplash girl who came in to me the other day, second whiplash, of course. So she is dizzy, she's vague in her head, she has brain fog, higher annoying sounds on the right. She has BPPV, benign positional paroxysmal vertigo. Not so much headaches, but like pains. And I examine her, and everything right cerebellum is just down. Dysdiadochokinesia, Romberg's sway to the right, and all the rest of it. And she has subluxations on both sides of her neck. But I choose to adjust on any functional neurology students in here? I choose to adjust on the side of the weaker cerebellum. And instantly, on all tests for cerebellum, she is equal. So what I'm saying here is why did I do that? Because 6 months before that, the older back surgery woman came in. Exactly the same situation. Her right cerebellum was down. I adjust the right side. She's amazeballs after 2 visits. She's stable. And I got carried away on the 3rd visit and adjusted the left side as well, because there was a subluxation on the left side. So I adjust both sides. And she calls me up the next day, "What did you do to me? I feel like crap. I'm unstable. I have pain. I'm dizzy. I'm falling over the place." And looking at my notes, I'm like, yeah, I know what? I know exactly what I did wrong. I'm really sorry. Come in and I'll fix it. And I know I can fix this. I test her. Right cerebellum is down. I adjust on the right side. She's good to go. So that has taught me the hard way, and thank you to my patients, to not just adjust anything and everything in sight, but really be careful to select who to do that too, because it's a very powerful thing. See, I'm on slide 10 out of 15. So that's good. I love adjusting. I've been out of school now for 12 years, and it's kind of freaky, and it's kind of like I should actually pay people that I can adjust them because it's so much fun. But as much as fun as it is, you can't adjust your way out of a vitamin D deficiency. If people are vitamin D deficient, you're not gonna bring up those numbers by adjusting them, right? If people are on drugs, and people will be on drugs, we can be against drugs, or we can be against the abuse of drugs, but people will be on drugs, and I think we should know about what it does to people, so we know when we're adjusting subluxations and when we're taking care of the side effects. You can't, if they're on statins, on cholesterol-lowering drugs, they will possibly develop myalgias or muscle pain. That could probably contract some muscles, and that could look like a subluxation. So you can keep adjusting them, but that'll keep coming back, which is great for the mortgage, right? Let's talk about being in business, but that's just not gonna cut it. If people are not drinking enough, you can't adjust your way out of that. You can't adjust somebody out of not doing sports, all right? You can't adjust someone out of sleep deprivation. So, you know, gotta stay curious, gotta stay learning. Man, Ryan, it's just right up my alley what you just said. And whatever you do philosophically or whatever you do practically in your practice, we help people move better. Movement is one of the best things you can do for your brain, which is great that you're all sitting down. It's the most researched thing to help with depression. It's the best thing you can do to prevent Alzheimer's. It is, when you look at the really big picture, helping humankind. If we can just get people to move better, that would be one of the best things we can do. What WCS has given me, heaps of connections worldwide. Thank you, Facebook, for that. For me, the proposals weren't actually the big thing. It's more the discussions that went before that and the discussions internally in your chapters. And as somebody was mentioning, what happens behind the big table there. Back in my day, the Congress was a lot smaller. It was like, I think the first one I went to was like 80 delegates at tops, where half was from ACC. Pretty much. And it meant that each delegate actually had mic time, that you had to formulate ideas based on what you just learned, basically, hey? So I would encourage you to get mic time and maybe break out in groups and discuss there and bring it back to the table. I'm almost done here. You're unique, just like everybody else. Take your time and understand something instead of memorizing it. If you can understand the principle, it's a lot smarter use of your brain. And we're all super passionate about what we do, which is that whenever things get heated in a discussion, just remember that, you know, we're all trying to improve mankind as we know it, and we do it as we see fit, and that is entirely okay. Just some books that I really love. If anybody has heard about functional neurology, that's great. Go do seminars. I can't stress that enough. That is my one regret. If I can have one, if I just have to choose one, that would be not getting started with functional neurology sooner. It is really done. It's like, for me, it's chiropractic 2.0. It's just taken it to a different level. If anybody had given me Datis's first book, Why Do I Still Have Thyroid Symptoms, at university, it's not because you have to be thyroid specialist, but it just really ties in thyroid, brain, adrenals, gut, liver, gallbladder, sex hormones, everything. You're like, if somebody just said it like that at the beginning, that would make so much more sense, and I would actually help so many more people. And just final tidbits. Ryan, you see how we're parallel fingers again. Show up, you're already here. Ask your questions, stay curious, as we were talking about this morning that Ed was beautifully saying about staying foolish. Stay curious, and it's amazing being a chiropractor. I can't stress that enough. It's gonna be so much more fun when you guys graduate. Thank you for your time.